I started Monkstown Laser Skin Clinic in 2007. I trained first in St Patrick's Hospital in James's Street. I spent 5 years there in psychiatry, which was wonderful, and I went from there to St Vincent's. I did a postgrad course in general nursing, and I spent the next 10 years after that nursing the terminally ill, which was wonderful. And then I took some time out to look after my babies, and then just by chance I went back. Hadn't planned to go back working again, but I went back and started in laser. That was in 1999. Then in 2007 I set up on my own. If it's any way uncomfortable, you just say stop or ouch or whatever, but we're ready to go. Okay? Okay. Here we do anything to do with anti-aging. We want to look your best for whatever age you are. And we achieve that by various different treatments. I do peels, microdermabrasion. I have a new machine now called Viora, which is an infusion super hydration collagen treatment. It's the one and only machine in the country. Great. We're all ready for. I'm going to just cleanse off the face first, because you've had your first treatment. And this is when I meet anybody first in the clinic, I do a consultation. Consultations take maybe 30 minutes, 40 minutes, and at that consultation I would assess the skin. I take a look at it and see what the patient would like to achieve and what I feel that I can do for the patient. Just going to turn this on. Okay, our energy is 45. That's very good, because if we're going to do the other treatments I use are Pelleve. Pelleve again is revolutionary. I had the first machine, Pelleve machine in the country. I got it back in November of last year. It's made by Elman International. It's an American machine, and it's the tops in skin tightening. How it works is it's a radio frequency. The energy is delivered to the subdermal layer. At the subdermal layer is where we have our collagen. So what it does is you heat the outer skin to about 40 degrees, and then the collagen layer heats up to maybe 50 and 60 degrees. It causes contraction of the collagen, and when you contract the collagen, it will automatically tighten the skin, tighten the connective tissue. So it gives you a firming and skin tightening. Okay, breathe. I just have a mirror here. I just want you to take a little look in and see. You see, we've got. Let me just look and see if I can see myself. Yeah, you look in and just see. We've got half the face. This one is right there. Okay, got half the face. I want you to look in. I see a little plumping on this side. I see these lines here lifted up a little bit. See on that side? The results speak for themselves. I think that anybody who's had a Pelleve, and sometimes you need a series of Pelleves. It's not just one. I use a ballpark figure that 35 to 45 may need one treatment, 45 to 55 2 treatments, and 55 to 65 possibly 3 treatments. And you will see the results. Sometimes I treat necks, and you see a little bit of a turkey neck. You know, they're losing their fatty tissue. What it does, it plumps them up. It tightens up the neck. You get firmness in the neck, tightens it up, and it even gives, when you treat it around the eye, it will give an eye lift, and it'll sort of open that eye, and people are very happy with what they see. You know, they see their face a little bit more alive. For Anita, I did some photorejuvenation. Photorejuvenation is it's a vascular treatment, and I use an IPL, intense pulse light, and it works for 2 main reasons, or maybe 3. One is to reduce redness and sometimes rosacea, and for sun damage, which we call pigmentation. It is, I think, the treatment of choice for rosacea. The reason why is that creams and lotions and potions don't work for rosacea. IPL is the only thing that works for rosacea. It will break down the red blood vessels. So when you break down the red blood vessels, you will have less of them, so you get less red. I don't do treatments just for the sake of doing treatments. I do treatments that I think will benefit somebody, and if I don't think that I can offer them anything, I will tell them that. For me, I gear everything towards people's budget. You know, you can spend a lot of money and not get the treatment, you not get the results you're looking for. So I try and narrow it down as to, you know, what maybe the patient, number one, wants to achieve, and what I could realistically achieve for them within a budget. Going to cleanse off the gel. I have a great rapport with my patients. we set a goal at the consultation. We set a goal, and I think 99.9% of times I reach that goal, and I do get satisfaction, and they get satisfaction, and I guess that's what gives me job satisfaction, when I see them happy. I love it. It's very different from other types of nursing, but the satisfaction you get, seeing people looking and feeling better, and particularly because we're in a recession, what better way to lift somebody's spirit than to make them look better and feel good about themselves.